Tonight on Scrappy Time, I'm talking to my good buddy Steve Wildsmith. We're going to be talking about addiction resources in Tennessee and the lack thereof, and what we can do to help people understand that addiction is a disease. Stick around, it's an important show. I watch the sun fall from a rock outcrop. The moon slowly rose and the valley filled with fog. And then I heard a commotion on the trail down below. Carbide lights were coming up the mountain, and they were led by Mother Jones singing, "Which side are you on, boys? Which side are you on?" I never wanted to leave the top of a mountain, 'cause Lord knows I love to get high. I never wanted to leave the top of a mountain unless I was headed to the by and by, to that mountain in the sky, the sweet by and by. Hey everybody, we're back here on the back porch again. I got Indy hanging out. It's a beautiful Saturday morning, although y'all are about to watch this Thursday night. But I'm hanging out with my good friend and the best journalist I've ever met in my life, Steve Wildsmith. How you doing, Steve?
I'm doing well, Jay. How are you?
I'm doing fine. Thanks for coming out to Rockford this morning.
It is an honor to be out here. I've been out here a couple times. I love your place. I love hanging out with you, so I'm grateful for the opportunity.
Awesome. Well, today we're going to talk about addiction and some mental health issues in Tennessee. And why don't you tell everybody a little bit about yourself and why I would have called you perhaps to come and talk about this.
Well, I'm Steve. I'm an addict, and that is an introduction that I use quite frequently because I've been clean and sober now for about 18 and a half years. But I'm still active in the East Tennessee recovery community, and as such, in a lot of meetings, a lot of groups, things like that, I introduce myself as such. Now, that is not the only thing that I am. I am a writer for the Daily Times. I work for Cornerstone of Recovery, a drug and alcohol treatment center here in Blount County. I'm a father, a husband, so many other things that most people would not associate with being an addict, Jay. But the caveat there is addict in recovery. And I've been given an opportunity because of, various support programs and things like that to build my life back. And I think that's probably, I believe, if I'm not mistaken, what you want to talk about is how we can expand those opportunities for others who similarly suffered.
Exactly. And so tell us a little bit about addiction as a disease, because I think a lot of folks, we consider all these other, things that we consider diseases to be something, that need to be treated and insurance should cover. Mm-hmm. But we don't think of addiction that way. So elaborate on that a little bit.
Addiction is recognized as a disease by the American Medical Association, the American Psychiatric Association, the World Health Organization. Every single medical and scientific community recognizes addiction as a disease because of the very specific biological changes that take place in the brain in addicts and alcoholics. Now, a couple of points, Jay, and I could talk for days on this. People like to say, well, it's a choice. Well, yes, it is something that begins with a choice, but so is a sexually transmitted disease, And you receive that, you get that disease because of a choice that you make. There are a lot of illnesses that begin because of a choice. That doesn't change the fact that they are still legitimate illnesses. And I think the biggest misconception is that if you look at chronic debilitating diseases, diabetes, hypertension, for example, there are relapse rates, meaning that people don't do the things that they need to do to take care of themselves. And in some cases, they fall back into those old behaviors, old lifestyles that can exacerbate their diseases. Diabetics, for example, heart disease, asthma, things like that. Now, the relapse rates for diabetes, for asthma, are around 50 to 70%. 50 to 70% of people who are diagnosed with that disease, who are doing something, taking care of themselves, they may slack. They may fall back into old habits, and their disease flares up. With addiction, it's about 40 to 60%. So there are some similarities with other diseases. The biggest thing is just not understanding those biological changes that take place in the brain that drive addictive behavior.
So when you got help 18 and a half years ago, I hope our system's improved over the last 2 decades, but what was the final straw that got you? Was it a program that we had here in Blount County? Was it jail? What was it?
Well, I don't want to use the term fortunate because, I very easily could have been and probably should have been. I was never arrested, but I just reached a point, man, where I was so tired of going to bed every night, praying to God to kill me in my sleep, and then cursing him when I opened my eyes the next morning because I was still alive. Trust me when I say this, Jake, no one hates themselves more than the addict. No one loathes the things that we are driven to do because of this disease than the person who's actually doing them. And a lot of people don't understand, they say, what is it about this particular drug? And it's impossible for me to kind of convey that overwhelming need. I just reached a point where I was tired of that. Fortunately, the only thing I had left was my job at the Daily Times. My boss at the time was someone who has made no secret about his own recovery and basically said, go get some help. I went to Peninsula Hospital here in Blount County. I detoxed for 6 days. And after that, I got lucky and got into a halfway house in Knoxville where I stayed for about 2 years. A lot of what I did was based on, my own willingness, but also I got lucky, man. There were systems in place at the time that I just happened to be able to access. For the most part, it is impossible for an addict or an alcoholic to wake up and say, I'm done, I can't do this anymore, I want to get help, and get help that same day. It's just, the system is to a point where it's overloaded. There are not enough resources. Because here's the thing, there's not a lot of addicts out there who are flush with cash, who can afford to go to treatment, or who have health insurance, who can get into a facility like Cornerstone Recovery. It's just, we need more options. We need more opportunities for people who want to get help to be able to get it and get it quickly.
So what's the main option that person has that wakes up today and wants and says, I'm going to go get help? What are the options? Has it changed any in the last 20 years?
No. There is one facility in East Tennessee that offers help for those with no money and no insurance. It's Centerpoint. It's run by Helen Ross McNabb out of Knoxville. Fantastic facility, Helen Ross McNabb, who is very active here in Blount County. Mm-hmm. They do great work. Unfortunately, you call them, the waiting list, it's about 3 months.
Wow.
Yeah. Now, fortunately, the state of Tennessee took some measures several years ago to set up what's called the Tennessee Red Line. And I don't have that number in front of me, but you can Google it, or maybe they'll put it up on the...
We'll put her up on the screen.
It's the Tennessee Red Line. It's a hotline that was developed in conjunction with Tennessee Association of Alcohol and Drug Abuse Counselors that you can call 24 hours a day, 7 days a week, and they will help you try to get services at some facility in the state of Tennessee. Unfortunately, because there's not a lot of state funding for this particular endeavor, I had somebody call it last week, and they said, oh yeah, we've got 3 facilities. Call these 3 facilities. She called all 3 of them, and all 3 of them said, no, I don't know why you're calling us. We can't help you. So as with a great many things that are government affiliated, there's a lot of miscommunication and a lot of dead ends. So these overdose numbers, and I like to look at, we're approaching, getting close. Probably, I think they say by December we'll have 200,000 COVID-19 deaths in America. Last year, provisional numbers provided by the Centers for Disease Control show there were around 72,000 overdoses in 2019.
Wow.
On top of that, the CDC also estimates that around 93,000 people die every year from alcohol-related causes, either cirrhosis of the liver, automobile accidents, violent deaths associated with alcohol. 93,000 deaths. So you combine that on an annual basis, every year we're losing the same amount of people to overdose and alcohol-related deaths as we have to COVID so far this year.
Wow. Yeah, that really kind of puts it into perspective.
I would like to see, Jay, a complete sort of reinvigoration of drug and alcohol treatment within the law enforcement system, where there are employees, maybe one per department, whose entire job is to work within the confines of the addiction treatment field. So, maybe you've got a social worker perhaps per shift. And if there is a call, this person goes out to the scene and starts getting this person's information, starts networking with other providers, gets this individual into treatment. Because all they're doing, they're taking him to a jail that's already overcrowded. They're taking him to a hospital that's already overtaxed. That's not where an individual like that needs to go. They need drug and alcohol treatment. Why can't we provide additional funding to our law enforcement agencies to take away some of these responsibilities that are sometimes life or death questions? Our law enforcement don't need to be in the business of being drug and alcohol treatment providers. Their job is to enforce the law. But if there are ways to increase funding to provide a network of treatment providers within law enforcement, I think it would solve a whole lot of problems and probably save a whole lot of lives.
Yeah, I would think so too. And so, obviously we need to support and fund the law enforcement side of things.
Absolutely.
But the other part I think that you mentioned earlier is, a lot of addicts don't have insurance.
They don't have money.
And that closes the door right away. And if we expanded Medicaid in Tennessee, which we've mentioned thousands of times, it seems like on this show, and all that money, and mental health is a big part of it. And we could do so much to help everybody.
Right. One of the things that we did at Cornerstone of Recovery is we saw that need, and we opened up a separate facility called Stepping Stone to Recovery. It's in Louisville, here in Blount County, and it is a Medicaid treatment provider. If you have any of the 3 plans offered by TennCare's managed care organizations, United Healthcare, AmeriGroup, or Blue Care, you can receive drug and alcohol treatment here in Blount County at Stepping Stone. Now, a lot of people don't know about it, and a lot of people just don't have Medicaid.
Yep.
Because they didn't expand it.
Exactly.
Because there are so many people out there who don't have insurance and don't have money. If we can expand that and increase it will increase access to drug and alcohol treatment for people who need it.
If someone's watching this and they have an addict in their family or struggling with addiction themselves and they live here in Blount County, what can they do? What's some of their options specifically?
Glad you asked that, Jay. There are a number of absolutely free 12-step and support groups that meet all the time here in Blount County. There are a number of different facilities here. Some of them, like Cornerstone Recovery, require private insurance or are private pay, but Stepping Stone to Recovery, we take Medicaid, we take the TennCare plans. In Knoxville, there are a number of different facilities. The best thing you can do is to get in touch with someone who is in the know in terms of who is aware of what these resources are. That Tennessee Red Line is a good one. Metro Drug Coalition is a good one. Just getting online and Googling, addiction recovery resources near me are going to pull up a whole list of things right here in Blount County that can help people.
All right, so last question here.
Okay.
I'm your state representative. We're going to go in the future here a little
Yeah.
bit, but I'm your state representative. and you're someone who's an expert on addiction and counseling for that and such. What do I need to do?
I think you need to spearhead, just like I talked about, an overhaul of how we approach addiction in these smaller communities, to fight for the funding that will complement and supplement law enforcement on a level that provides help instead of, I'm not sure what to do with this guy, let's take him to jail or the hospital. I think that right there, I don't know what that looks like, I don't even know how it starts, but Representative Clark, I believe in you, and I think you can be the person to get it done.
Well, thank you, Steve Wildsmith. I believe in you, and if you don't know about Steve's past or haven't read any of his columns that used to be in the Daily Times related to addiction, he has a vast knowledge and an open book about his own story, and there's no telling how many lives he's saved in the process of telling that story. So thank you, Steve, for what you do.
Thank you for having me.
It's an important issue, and we got a lot of work to do.
Absolutely. Glad to be here, Jay. Thank you.
He was behind me, right there in my mirror, that red, white, and blue STP. If it hadn't been for the number 483, I could have been the king.
I hope y'all enjoyed that conversation I had with my buddy Steve Wildsmith. It's a really important issue and a very complicated one. And unfortunately, there aren't going to be simple answers. At the same time, I want to highlight 3 things that Steve mentioned. One is, if we expanded Medicaid in Tennessee, we have hundreds of thousands of Tennesseans that might be struggling with addiction and other mental health issues that would give them access to our healthcare system. Secondly, I want to work with law enforcement to figure out better ways and more productive, compassionate ways to deal with addicts when we get a call for 911 to go deal with someone that might have had an overdose issue. Thirdly, we just simply need to have some compassion. When we make laws in Nashville, we need to understand that mental health issues, including addiction, is a healthcare issue and needs to be treated as such. And our laws need to reflect that. If you're struggling with any kind of addiction or know someone that is, check out the resources on the screen below. And also, don't hesitate to give Steve Wildsmith an email. He'll respond, just like I will if you call me, 865-340-9183. And unlike my opponent, I'll call you back.
And prayed the Lord my soul to keep, and that I'd see Petey when I die. And Lord, I hope you love dogs too. I think Jesus loves dogs too. As the years passed on, many dogs.
Hey everybody, thanks for tuning in tonight. I hope you'll tune in next Thursday at 8 o'clock for the next episode of Scrappy Time. I'm not sure what it's going to be, but I promise you it's going to be a good one. We got a bunch of different topics to talk about coming up in the next few weeks leading up to the election. In the meantime, make sure you're registered to vote. Go Bubba. And you've been coming around a little more each day. Could you stop by tomorrow so we can play? And we'll start spinning and we'll be grinning, 'cause this love we have, it feels so good it can't be bad. Well, my morning sucked. Hey everybody, I want you to know that campaigns run on money and we need your help. Whether it's a one-time payment or recurring, you can do it at jclark410.com. Just when I think I can't take much more,